Thank you all for joining us today. We are excited to launch this webinar series. Our goal is to share with you the global impact of ALYN Hospital's work and research through in-depth presentations provided by ALYN doctors and staff who every day are engaged in life-changing work, both for the children at ALYN as well as for children with disabilities around the world. Our first speaker, Dr. Maurice Berry, is the Director General of ALYN Hospital in Jerusalem. Previous to her current position, she served as Vice Hospital Director and Head of the Medical Daycare Rehabilitation Department at ALYN. Dr. Berry also heads the Multidisciplinary Clinic for Infants and Children with Feeding Disorders. She trained as a pediatrician at Hebrew University Hadassah Medical Center in Jerusalem and holds a master's degree in public administration from the John F. Kennedy School of Government at Harvard University as a Wexner Israel Fellow. Those of you who have heard Dr. Berry speak before know her words are always inspirational. Those of you who have not, you are in for a real treat. There is a reason why ALYN Hospital is a premier institution for pediatric rehabilitation. It is a reflection of the level of professionalism and commitment provided by those like Dr. Berry, who have worked so hard to raise ALYN to the global reputation it enjoys. In celebration of Women's History Month, we are especially honored to have Dr. Maurice Berry as our first guest speaker. Before I turn the floor to Dr. Berry, I want to let you know that there will be time at the end for Q&A. Feel free to use the Q&A box at the bottom of your screen to submit your questions and/or raise your hand using the hand icon on the bottom of your screen, and we will call on you at the end of her remarks. Again, thank you everyone for joining. Dr. Berry, over to you.
Thank you, Mayan. It's an honor and a privilege to be with everybody here today, and thank you so much for attending. What I would like to do today is give you a peep or a view through my eyes to what happened at ALYN over the last 2 very eventful years, how we struggled to keep ALYN going, and how we are now investing our times and efforts in taking the lessons learned from that period forward into the next phase of our work. Allow me, please, to share a presentation with you. So just hold a moment. I will do that. It is, of course, one of the most clear outcomes of the last 2 years is that we've all become very adept in using Zoom and other platforms for online sharing, and I will go deeper into that in a moment. I'd like to start by thanking our friends of ALYN Hospital in North America and our friends all over the world who help us be better, be more competent, and help more children. So thank you everybody who's on board with us. Even though a lot of the names that I see are recognized and I know you people, I know that there are some attendees who do not know ALYN Hospital. So let me begin by just introducing who we are. So we are the premier and only institution in Israel dedicated solely to the rehabilitation of children from birth to adulthood, and we try to give them a safe place, a place with which they can get help, either as inpatients or outpatients, whether they need a stepping stone between being at home, going to school, if they need devices, if they need consultations, if they need medical attention. We try to be there for them because we know that it's very easy to get lost in the healthcare system. Even the best healthcare system speaks a different language from the one that most people speak on a day-to-day basis. And especially for families of children with special needs, the idea that they have one place that they can go to with all their questions, that will have every bit of information that they need accessible to them, or will be able to make sure that they are referred to the best place, is a safety net that helps many, many families deal with whatever problems they have. We have 120 beds, but actually that is on our license. don't tell the Ministry of Health in Israel, we actually do serve a lot more children, because a lot of our work is now ambulatory. The whole world changes from inpatient, in-hospital services to community services, and we're trying to move along with that because we know the best place for a child is at home. So we're trying to move from having the child sleep at ALYN overnight throughout the period of the rehabilitation to a system in which they spend the least possible number of nights with us, and the rest of the care they can get through day therapy or through clinics, and as you'll see soon, also via remote therapy. We take care of children with many different aspects. I will not go into all this horrendous list of problems, but the common thing about them, that these are all situations in which a child cannot grow and develop and live the regular life of a normal child, because they're dealing with pain, they're dealing with incapacity, they're dealing with the difference between them and their surrounding. They cannot gain the development milestones that they need to gain in order to grow up as independent adults and be partners in human society. So our goal at ALYN is not only to deal with the actual injuries, the burns, the post-cancer problems, the chronic pain, but make sure that the children are free to participate in just being children. So it's a lot more than a regular hospital. We don't look at ourselves as a regular hospital. We do not see our children as sick. We see them as people, young people, dealing with complex situations that it is our duty to make them overcome, or at least deal with. So as you can see, I think this is the most succinct sentence I can say, that rehabilitation is about acquiring the skills necessary for real-world participation in the community. And if you can see this child in a wheelchair, and those of you who are professionals will assume that this child is hemiparetic because he has a brace on one leg and a splint on one arm, is using the right hand, but what the child is actually doing is participating in a normative activity to children, laughing and playing and just being a child. We cannot take childhood away from children. But actually, 2 years ago, March 15th, really almost on the day, the world of ALYN, the world of these children, the world of everybody around the globe changed pretty abruptly. And that was when we first encountered COVID. Suddenly, the world from one day to the next had new rules. And these new rules applied to everybody, but they specifically applied to us dealing with children with special needs. Okay, so when we approach a child, when we want to take care of a child, we look at a whole array of issues surrounding the child's problems. This is a variation on a very basic table, which is called the International Classification of Function. This has been adapted through a wonderful idea by one of the leading professors in childhood development, Professor Peter Rosenbaum, who's a Canadian. And he changed the terminology to child-friendly terminology, so that when we look at the child, we look at their function, their family life, their fitness, because even children with disabilities need to be fit, their interaction with their friends, and their fun that they need to have, because children who don't have fun cannot participate and learn and develop, so that we can look into their future. So these are the components of a child's life that we need to look at. But then COVID hits us, and what happened? From one day to the next, grandparents were taken away from the families. We were worried, I mean, everybody was worried that the older family members had to be protected and they were kept away from children. And in Israel, I don't absolutely know that it's in every place around the world the same thing, but grandparents are a daily part of the family in the most day-to-day functions. They help the families survive and take care of the children. So taking the grandparents away from the family was a huge burden on parents raising children with special needs, and also emotionally very, very difficult for everybody. Then you couldn't go outside because we had lockdowns. There goes fitness. We couldn't, if you were allowed to exercise some of the time, but All the children's playgrounds in Israel were surrounded by police tape. It was forbidden to go on the slides. You couldn't go into health centers, fitness centers, playgrounds, and indoor playgrounds, outdoor playgrounds. Everything was forbidden, so no fitness. You couldn't meet with friends because everybody was a suspect. It's very little fun. And for children with special needs, that was a real threat towards how are they going to deal with it looking to the future. Now, looking back on these 2 years, I think we can safely say that every single child around the world has been hit by this. And all these things relating to children with special needs actually to relate to our children, even if they have, you know, healthy 2 legs and a tongue that they can speak Shakespearean English with. Everybody was hit by these issues, and we're only now seeing the devastating effects that this has on society, on the social norms, on the interactions of children. But children with special needs who actually needed more help to close the gaps suffered the most. So what happened at the Lien hospital is that from one day to the next, we entered an emergency mode. Do you remember the pictures from February and March 2000? Wards overwhelmed, especially the first place that was really scary was Italy. We saw medical staff just succumbing to the disease, people dying all over the place. It was quite clear that this is a horrendous disease and that it spreads very fast. And we were quite sure that the patients that we care for, especially the patients who are on home ventilators, are at huge risk. And also, there is a huge risk of them spreading the disease around. So what do? How can we allow children who are spreading disease potentially keep coming to ALYN? Maybe we need to close the hospital. Maybe all these children need to just be at home or around behind closed doors. So from one day to the next, we took the huge step of splitting the hospital in 2. We built a wall in the middle of the hospital. And for a year and more, we operated 2 completely separate spaces. One designated for children who are on ventilators, a space in which people worked wearing the hazmat suits with all the gear and every precaution taken. You know, the kitchens were separate, the pharmacy was separate, parents going in and out and staff going in and out. We never crossed each other's path. Complete separation so that we can make sure that we can keep the other part of the hospital, the part that doesn't care for children on ventilators, active and healthy. This was a huge endeavor. Sorry, excuse me. So now I found myself on one side of the wall, being overseeing a hospital into which I'm not going because I'm not part of the team that cares for the children on ventilators. We had conversations with the team. There were issues such as, are we afraid to die? What is our role as physicians and therapists? Are we risking our lives to help these children? Is it worthwhile? Those were real issues being discussed. On the first day that we split the hospital, we sat down just before separating, and each of us wrote on a little piece of paper how long we think this will last. I remember thinking this is going to last 2 weeks to 1 month. The most pessimistic person in the room said it's going to last till July. I said, you're making too much of it. That's impossible. We're not going to be in this situation until July. So we had no idea what we're walking into. So that was one step. Protecting the children and the children on ventilators was one step. And I can tell you now that it turned out to be a disease that does not affect children on ventilators more than others. It did not make our children sicker than that, at least not the first and the second wave, but we didn't know that at the time. The other thing was that when there was a lockdown, we had to close the school and the children couldn't come to us because they lived far away. Now, these are children in the middle of a rehabilitation. These are children that if you stop the rehabilitation in the middle, there's no going back to it. It's not a piano lesson that you just go back and pick up pieces. These are children that if they don't move forward, their situation will deteriorate, which means that they will lose ground, which means that they will never potentially be able to overcome the injuries that they have, which means that they will grow up to be adults with more disability than they should have been than if this hadn't happened. And we couldn't afford it. It was impossible for us to allow this to happen. So one day to the next, we found that we could come up with many different programs that we couldn't think of before. For instance, for years, we've been trying to implement remote therapy in rehabilitation. And our professional staff was so hesitant and so unsure that it would be just as good as seeing the child face to face that we never were actually able to push it forward. Corona struck, and there was absolutely nothing to do but go into remote therapy. And we did that immediately. What we did is go on Zoom, just like we're doing now. And now it seems to be completely natural. But I remember the first and the second meetings, nobody knew, unmute yourself, don't unmute yourself. You remember that, that was the beginning, but we're all now quite professional at using it. And we decided to take a hard look and say, what can we do and what cannot we do? And I'm usually use this algorithm, which is say, what am I worrying about? Is it a problem that I can do something about? I can't do anything about COVID being out there, but I can do something about children accessing care. So we work out what we can do. If we can't deal with it, just let it go. There's no point in sitting down and worrying about what COVID will do to the children. The point is try to see what we can do and go there. Is there anything that I can do right now? If not, then maybe we should think about the future. When there's a lockdown, there's a lockdown. We can't worry about the children not receiving exercise and not being fit while in lockdown. What we can do is trying to make sure that we give them access to at-home therapy and do it immediately and let go of the things that we can't change. Now, this is my life philosophy, and I openly share it with you guys free because it works. If you can't do anything about it, let it go. So what we did is, this is a grand round. I'm in my office. These are the people working in the respiratory rehabilitation department on the way to gearing up. I monitored everything because I do grand rounds every few days to make sure that I know exactly what's happening in the hospital. Couldn't do it, we do it. Somebody was holding the phone, and I just went from room to room. There were children who were admitted, treated, and discharged without me actually seeing them one time, but I always knew who they are, what their problem is, who the parents are, etc. So we monitored everybody remotely. That was one thing. Then we had all the administrators working from home. And we had several scenarios where the therapists were at home and the child was in hospital, where the therapist was at home and the child was at home, or maybe the therapist was in the hospital and the child was at home. What we made sure that we record every therapy and that we get reimbursed for it, which wasn't easy to begin with. And once that hurdle was over with the payments, we knew that this is going to be something that we can use in the future. So this is a therapist session. You can see a therapist on the left here working with a laptop or an iPad. And there's a child at home receiving the therapy. And you can see on the right side, there's parents are participating, teachers are participating, as well as the therapists. And we found out some amazing things. First of all, we found out that there is a lot of things that you can do at home, which you cannot do in hospital. It's the child's personal environment. When you look around and you see where they live, what toys they have, what furniture they have, how you can implement your exercises at home. For some of the kids, it actually made huge benefit to be aware of their surrounding, to help the parents understand what they can do with them at home, to engage with the children. It never worked with children that we didn't know ahead of time. So for a new child to just start therapy online, that was a huge problem. But for children that we already knew, who have been at home for some of the time or on and off, this was a huge benefit. And we didn't keep it at that. We actually monitored and kept all the data. And not long ago, we published this study, Lessons Learned During a Naturalistic Study on Online Treatment of Pediatric Rehabilitation, because a naturalistic study means we actually monitored what happened on the ground. It wasn't a study, a researcher said, okay, we're going to split the kids into two groups. One is going to get online therapy, the other is not going to get online therapy, and we'll compare them and see who does best. No, this was just how many therapies could we give these children a month? How satisfied were the families? How satisfied were the therapists? And from this on, now we're moving forward with our new research center to investigate the actual efficacy of the treatment. So this was just a preliminary work, but we gathered thousands of therapy sessions that we could study and monitor. And this was wonderful because it allowed the therapists and the children to give us the feedback to see what are we doing right or wrong. And actually, the deputy director of ALYN, Dr. Nomi Geffen, who is an OT, she's now sitting on the advisory board of the Ministry of Health, dealing with remote therapy and coming up with guidelines how to move forward with the pediatric rehabilitation and remote therapy. We did other things. For instance, our Pele program, the Innovation Center, who does personalized solutions, couldn't work with the children one-on-one. So this is what they did. They sent short video clips with explanations how to do things. So this is very short and you don't need the soundtrack. Just hope that it. How do you keep a book open when you're at home and you only have one hand to work? So this is just one example of the ideas that people came up with during this period. Now, we know that it's here to stay, remote therapy. We know that we still have a lot to learn about it. We know that what helped us do that, what helped us split the hospital in two, create these therapies, go into a different mode, was the fact that we're very agile because we're small and we don't need to wait for instructions from higher sources. And because of that, that's what makes ALYN so special in adapting to situations that are changing all the time. And the takeaways from that are implemented all the time. For instance, well, what we found out that our EMR, electronic medical record system, needs an update. So now we're updating it. We found out that some areas in East Jerusalem or in the Haredi, the ultra-Orthodox communities, had problems dealing with the therapy based through cellular data. So we had to find solutions for them with the technical and cultural barriers that we need to access and move over. But because we're already culturally aware and very attuned to this, it was easier for us to access the people who could give us the solutions for these problems and not get stuck on them. Well, I'm jumping quickly forward to the situation right now. We're dealing with a new crisis around the world, and we're here and we want to help. We see that there's a situation in which children with special needs are there in the Ukraine and are not getting the therapy that they need. We know that because we have connections there. We know that because years ago, ALYN had a connection with an orphanage in Odessa. Even though we weren't connected the last few years, but we were. So we know that these children who are now lying in hospitals there will not get access to rehabilitation the way that they need. They might not have a home to go back to. They might not have a safe situation. They must be the post-traumatic and dealing with a lot of anxiety. So we asked ourselves, how can we help? Now we're too small and too insignificant to actually send help there. Also, we will not risk our people. We've already learned lessons from sending people to Armenia and to Haiti and other places. That our ability to help there on the ground is very limited. So what we decided to do is to come out and call on anybody who needs our help to reach out, and we will give the care for the children if they can get here, and we will help them with the paperwork. If they're already in Israel, they're welcome to stop by at ALYN. We'll assess them. If they're in the Ukraine, they can contact us and we'll try to help them either remotely or if we can get them to come. And right now, at this moment, I have I've got several children lined up who are supposed to come to ALYN in different stages of the procedure. Some are already in Israel, some are on their way, some with brain injuries, with ongoing neuromuscular diseases or post-surgical cases. We know that we can only be a safe haven for them for a short while, but if we can bridge the gap between where they need to be and where they are right now, we're going to do our best to try and help. That's all we can say for now. And I will be happy to answer any question. Yes.
What did you find to be the most frustrating part of dealing with two hospitals at the same time?
I think the most frustrating thing was the unbelievable number of changes that we had to go through the protocols whenever the team managed to get their head around one set of protocols and way of dealing with the situation. Then another issue came up. And it was sometimes frustrating to be on one side of the so-called wall and try to understand what's going on the other side. Communication was an issue. Teams that split and were not part of the day-to-day activities of each other was an issue. So mostly it was dealing with the staff anxiety, because everybody was dealing with cases at home as well, and their own parents and their own situation with the educational system being closed. We tried to help the staff. I see that there is a question about that. We tried to help the staff by providing our social workers and our psychologists to also help the staff. They were dealing, of course, with their own things. We had Zoom meetings of the whole hospitals to try and discuss things. We did a few small events, such as sending out little gifts to everybody who was participating. We couldn't eat together in the dining room, so we sent every worker in the hospital as like a reusable set of like a lunchbox that they could go down to the dining room and fill with, and it said thank you. We gave certificates to specific teams who did really well. And I know that people have those certificates on the wall. We tried to get people to take a breather, but there was no place to go. You couldn't take vacation because there was nowhere to go. If you stayed at home, you just stayed with your children. I think some of the people actually came to work to get away from being at home all the time with the children. I think that what helped most of all the team is the idea that when everybody else has to be stuck at home and feel useless, we had a purpose. And that feeling that we gave the team all the time, your being here is very meaningful. Your being here has an impact. You are making a change, you are making a difference. I think that helped people deal with the situation a lot. I'm looking at the questions. As I said, we had I'm asked if we had staff leave. No, actually, no, very few people left for various reasons. First of all, as I said, it was good to feel that you have a purpose, and there was nothing out there. People were losing their work. We didn't have to lay off people, and we managed to keep, even though the number of therapists actually went down, we kept all the staff. We didn't fire people, we didn't let people go, because our idea all the time was the day after this is over, we will be inundated with patients. And indeed, that's what happened, because we returned to work much earlier than the community services did. So for a while, we really were overwhelmed with children, couldn't access other places who usually get services through the school or through their community, and they had to come to hospitals. So we had a lot of activity. and we could keep all their staff. And very few people actually decided to leave, and that was for their own private reasons. Well, somebody's asking me how was medication delivered to outpatients. Outpatients, that means that they come to the hospital. So if they need a medication, they get it at the hospital. But so there was no problem with that. If the children were at home, then they're providers in the community, because Israel has a system in which sick funds take care of the children. So if they couldn't come to ALYN, the sick funds would take care of their medication. I would like to point out that indeed we were very, very scared for our financial stability and our ability to survive as an institution, because we knew that we're taking care of fewer children, we're keeping the staff, and donations were down because, you know, first of all, everybody was hit financially, and second of all, everybody was, you know, dealing with their own situations and providing emergency help, and donors sometimes looked at other places that thought that they may have needs that are more urgent. But we have such a good group of friends, and they kept us afloat for quite a while. And it is a challenge now that we're back to full capacity to make sure that we live true to this trust. We also had, for the first time in ALYN's history, help from the Israeli Ministry of Health. For all kinds of reasons, we've managed to get to the right people, and they did reach out and give us money, for which I'm very grateful. It doesn't solve our problems to the future, because this was a one-time COVID-related budget, but it did help us pull through. We cannot survive without donations, because even though we get paid for every child that we take care of, our out-of-pocket expenses are much more than actually we get. A regular hospital with many, many departments, they make money on some of the patients and they lose money on some of the patients. They make money on surgeries, on interventions, on the cardiology, on the intensive care. Nobody makes money. And with children with special needs and rehabilitation, nobody ever makes money on these children. Or adults, for that being said. So our only way to survive long is to either be funded by you guys who help us so much, or find other ways to try and help ourselves, which we're doing by now funding research and innovation, in the hope that one day we'll come up with a solution that will be a unicorn that will keep ALYN floating for the next 20 years. Or that the Israeli government will change its priorities and understand that investing in a single child saves so much money down the road for the whole of the country. But you know, politics and policy are such that long-term views are difficult to hold, even for the people with best intentions, because they have to look at the next elections and the next budget. So I wouldn't hold my breath for that. I want to tell you a story from my own clinic, maybe, and with that, of a child that remote therapy really made a difference for. We had a child that we cared for. I run a multidisciplinary clinic that helps children who don't eat according to their age and abilities survive. Sometimes they're unable to eat because of muscular issues, breathing problems, multiple epileptic seizures, all kinds of problems. And sometimes they've overcome their medical problems, but because they haven't learned, because it is a learning, there's a learning curve in eating as in anything else, they've never learned to actually feed themselves and provide enough calories for themselves. They don't eat enough. And we had such a child at home, wonderful pair of parents, 3 years old, who underwent surgery. He was born with his esophagus not connected to his stomach. It happens sometimes. Thank goodness, now we have surgeries to connect that. It solves most of the problem, not all the problems. And this specific child got stuck somewhere. Couldn't eat, couldn't munch, ate very, very little, survived on formulas. We couldn't move forward with him, and we were a little bit frustrated. And then COVID struck and he was stuck home with his parents. And what happened is we went on remote therapy with these parents, and we suddenly saw their kitchen. We could help them. They had all the time in the world. These are parents who worked around the clock. They're very busy people. They were not neglecting parents in any way. They were just, you know, working 9 to 5, taking care of a house. They did not have time with the children throughout the day, but only in the evening when the child's already tired. Now, what happened there? They were in lockdown. They were at home with the child. 3 times a day, they prepared meals with the children. They sat down and had breakfast, lunch, and dinner with them. Around the clock, they found out what the child's preferences, what their abilities. It didn't take long. It took, I think, 2 weeks into the lockdown, and the child started eating so much better. Now, the child started eating better. The parents were more relaxed. The parents were more relaxed. Everything became fun around the table. And the child's growth charts just moved up. And we didn't change the treatment that we gave. We didn't change the advice that we gave. What changed was the home environment and our ability to just monitor from far away and make sure that it changes. Because if you remember the chart, the child is not only a child, it's the family, it's the fun, it's the participation. And that is just one child. It's called Amitai. I will not forget this child and how much he moved forward due to COVID. Is there any plan to expand the Lien to serve more children? Well, there's always. We take care of as many children as need to come. We're actually in the middle of renovating the respiratory rehabilitation department that we're going up with 25% more beds. So we'll be able to make sure that children don't wait in intensive care units before they come to us. We've become so adept in making sure that the turnover of the beds is pretty fast in the general rehabilitation wing, that children don't usually wait long. If they need a place, they'll come. Our capacity is limited by the number of therapists that we have and the number of rooms that we have at a certain time. But this is expandable. At this moment in time, we believe that we don't need to build a new building. We might one day need to build a new building, but right now we're trying to take, you know, ALYN, the building it's a wonderful building, but it's 60 years old, and all kinds of ideas about what's appropriate and the you know, the conditions in which parents would like to stay at ALYN have changed. And also we have a lot more, unfortunately, a lot more resistant bacteria. So we want to keep children separate from each other, and COVID was an opportunity to change that. So we're expanding the space of the departments, the inpatient departments, without taking in more children actually, but just making the conditions better for the parents and the children. And we're trying to make sure that we have enough spaces to care for the children, and also to have enough space for the therapists to actually have offices, and the students. It's not easy. I guess we will expand in the future, but not next year. I'm being asked who are we contracted with if the patient needs surgery or any. We're not contracted with everybody. Every child in Israel is covered by their sick funds, by their health funds. So they will be referred back. If a child needs surgery, we will recommend the surgery, but the family will actually be able to go and choose among the various the various doctors that the provider covers, where and how they want to have the surgery. And usually the children get serviced by the people that the family chooses. It's very rare that the family cannot access the doctor that they would actually like to have surgery. And we serve all of Israel, and all of the doctors, there's not one doctor in Israel who doesn't refer children to us for rehabilitation. So we're not contracted to anybody. We serve everybody, and we're in a really good connection. By the way, another thing about the COVID, because we got so used to working through Zoom, we have doctors joining our meetings and joining the actual meetings with the parents. For instance, we have a motion lab. We do gait analysis. We have the orthopedic surgeon from up north in Naharia join the team when they're discussing the actual gait analysis in the lab while the child is in the lab, in the middle of the immersion with the 3D gaming, and we're collecting all the data with the EMG and the cameras and everything. And their surgeon from somewhere up north will be there in the discussion with us, because everybody's so used now to working through Zoom. That's a huge benefit. What is the one takeaway that we can share with our friends to promote ALYN? I think that being a place that's dedicated to rehabilitation is about adapting all the time. That's what we do. We adapt to the child's needs, and the child and the family needs to adapt to a new situation. We're so focused on adaptation and changing. We're so used to the process of never being in the same space that we're very good with dealing with emergencies and with things that suddenly happen. You know, there's a saying most places say to their team, guys, you need to think outside the box. I need to say to my team, guys, there's a box, think within it sometimes, because everybody's trying their own solutions. So innovation and agility and being able to adapt, this is our strength. And this is what makes us strong and different and able to help all these children.
Beautiful summary of what ALYN is. Your final words. Does anyone have any more questions? Okay, thank you, Dr. Berry, for your time and your knowledge. And thank you to all of our participants. We will be sharing a recording of this for anyone who missed it as well. And feel free to reach out with any questions. And thank you again.
Thank you all, guys. It was a pleasure.